Thank you. Assalamu alaikum. Welcome to the last session. And thank you for staying with us until now. And there are 2 more hours to go. We have 6 speakers in the last session. And I would love kindly to ask the speakers, please stick to time. It's the last session. People are tired. But we will start this session by a unique lecture from Dr. Syed Osman Ahmed, who is a consultant, a hematologist at King Faisal Specialist Hospital and Research Center, Riyadh. He is the director of the Adult CAR T-cell program at the institution, and his main interests are in AML and transplantation. But his talk is not going to be in AML and transplantation. He's going to shift gears from trials and probably tell us about career path in hematology and unmet needs. Please mention the career path for older physicians, not only for younger physicians. Thank you, Dr. Syed. Go ahead.
Thank you very much, Dr. Ahmed. Thank you, Dr. Hanan. Thank you to the organizers. A big thank you, actually. I might just give a hand of applause to Riyadh al-Faqih and the team who have, mashallah, put this together. But not only that, but stuck to time. So I have to continue to stick to time. So this is, as you said, a very... Again, forward. Okay. So I'm not too sure if I had suggested this or we discussed this between us, but I think there's something to say, and it's great that we have. I hope we have... How many fellows? So this will be light-hearted. More light-hearted than Dr. Ghazi's talk, I'll say. So, bismillah. So how many fellows do we have in the audience? Raise your hands. I want to see more fellows, more. Even if you're not, just raise your hands. There you go. Okay, fine. Okay. So if we're talking about, so it talks about career paths and unmet needs, but those are 2 different things, because the career paths is for the fellows to decide about, and the unmet needs are for the policymakers and the healthcare services and the administrators amongst us. So let's. Now, there is, obviously, the countries with Vision 2030, there is a healthcare sector transformation program. And one of those pillars of the healthcare transformation is increased access to care. And that addresses shortages in workforce and manpower and shortages in beds. So, for example, this is from Al Jazeera Finance. So in Saudi Arabia, you have 2.2 beds for every 1,000 population versus 4.4 beds per 1,000. So the kingdom is behind, and part of the vision is to catch up with that. So capacity, beds, workforce. So let's talk to the fellows first, okay? And I dedicate the next 15 minutes to the fellows, and hopefully we'll have some time for discussion. So purpose. So again, this is not going to be an academic talk. It is going to be a bit of maybe a pep talk and some food for thought for you. So I think for fellows, it's helpful at this stage in your career to think of what gets you up at night, what motivates you to do what you want to do, and what will continue to motivate you during your career. And it doesn't, it's okay if it comes a bit later. You don't have to have gone to medical school with it, but you will find that during your years, you will find, okay, that is the single most important thing for me, okay? I need to think about that. Now, is Abdurrahman Nasri here? Because I'm hoping, because I said I'm giving a talk for the fellows, and he shared this video, and I hope we can play that video. Can we play that video, please? Oh, there it is. There you go. Where's Abdurrahman? He's not here. Okay, well, please tell him that. Okay, so there you go. Doctor starting. I've cut off, unfortunately, subtitles. Basically, he's saying, why are we here? What is this all about? And why, for God's sake, are we here? So, yes, as a fellow, you can feel like that. Sometimes, I think Dr. Ayman would agree, we all feel like that at times in our career. But it's helpful to have a sense of purpose. So many of you may have heard of a Japanese concept called ikigai. I learned about this from a friend of mine who'd done a TEDx-like video. So the Ikigai is a Japanese sense of, sorry, do you mind? Yeah, so the Ikigai is a Japanese sense of purpose to bring you happiness. And it is your sense of purpose. So, you know, it has these circles as what you, so let's think of this as a hematologist, fellows. So what you can get paid for, all right, you can get paid as a hematologist. What the world needs, so think about it as a hematologist, and think about it as a hematologist in Saudi Arabia. What you love, and what you're good at. So when you put those circles together, if all of those converge, then that's your Ikigai. So for example, let's try, for example, you might be interested in sickle cell disease, okay? I'm sure Dr. Muharrab will be proud of me that I'm trying to sell sickle cell to our fellows and promotion of sickle. So, for example, there is a huge need for sickle cell. Physicians, sickle cell programs, sickle cell centers of excellence. There's a huge unmet need. You know, many of these patients are wanted, and for a long time they've not been glamorous. Well, they haven't been glamorous till, you know, we've had a talk from Dr. Abir Hanna in gene therapy. Now sickle cell is glamorous, so that's good. So, you know, there will be more jobs to come in sickle cell disease. What the world needs, certainly the kingdom needs, more physicians and specialists treating patients with sickle cell disease. What you love. Now, that's something that has to come from within you. And if you work in a program, for example, for sickle, which is well-structured and comprehensive, you know, it is actually quite an enjoyable specialty. And then you'll become good at it. Okay, so where these all converge, that's your Ikigai. So try to find your Ikigai at this stage in your career. Try to find what you're good at, what you love, what the world needs, and what you can get paid for. But you might, you know, you might prioritize these. What is the most important thing for you? Now, let me give you some food for thought here. So, you know, what you're here for, what gets you up in the morning and gets you out of bed. So you need something that drives you. And if it could be this, in terms of purpose, think about a patient, and we presented this in our grand round, is, you know, when you ask people, why are you here? Why do we come to work? Everyone's got something slightly different. And if you think of it from the perspective of a patient with a cancer or a disorder that is affecting or disrupting their life, and they approach a center like this, you know, what do they want? What are they looking for? They don't care really how many publications you've got. They don't care how well you speak. They don't, you know, what they're looking for is that you will help them get back to a normal life. So if I could suggest a purpose for you, it is this, is that you have people whose lives have been disrupted by their disease or the symptoms, or their life is potentially cut short. So if you could make it your endeavor to try to either do everything that you can at your disposal to improve their survival, so you can go out there and get the best possible treatment and strive for that, to improve their survival and or their quality of life, so that that person can live like their age-matched peer. So 5 years down the line, you can see them in clinic once a year. So if you make that your endeavor, then when you come to the end of your life, that you will feel a sense of satisfaction. Okay? So, impact. Now, we could do lots of things in our professional careers, but think of something that can be impactful, like we said before. So if you can aim to improve survival, you know, it doesn't matter if you're a fellow, if you just started, think of something, see a problem where you are, and see, well, how can I solve that problem? So, for example, we have Dr. Shukri over here and Dr. Mortman before that. You know, we have problems treating neutropenic sepsis in time. And if you could treat neutropenic sepsis in time, you could improve survival. You can save lives. So if you could do small interventions to improve the treatment of neutropenic sepsis, you can save lives. That's something impactful. You may not write a paper about it, all right? It may not get published in Blood or something, but you're doing something that can reduce morbidity and mortality. So think of something that's impactful. That will give you a sense of purpose and satisfaction. Okay? Now, going back to that video of 13 years, again, Nasru's not here, but you know, it says 13 years post-training. So Now, there's a 2-year basic fellowship program in Saudi. So if we talk about, the taller a building is, the deeper the foundation needs to be, okay? So, and once you've built a building, if you think you want to make it taller, you can't now then go back and dig a deeper foundation. So, build your foundations, fellows, and enjoy the journey. It's not about completing your fellowship. These fellowship years will not come back to you, so make the most of it. As we said, once you start building, you can't go back and dig deeper. So, now if you want to talk about time, then, it could be really bad and you could be training in the UK, right? Dr. Abu Habab over here has a special liking for the UK system, that's right. So, and we often argue about it. So, and UK has a system of getting free labor out of the trainees. So, if we look at the blue boxes, so this is basic training on top. So, 5 years of medical school, 2 years of what's called foundation year, it's sort of the internship, and then core training is like your residency, and then you have a minimum of 5 years, which is called specialist training. So, once you qualify, you have about 9 years before you get your CCT. But a few things that are something that we can gain from in what they do there is that there are always options to incorporate research. So in your undergraduate years, almost half of the medical students might do what's called an intercalated BSc, where you do 1 year of, say, neuroscience, or 1 year of genetics, where you spend the year reading Nature, Cell, basic science, animal experiments, and you do a dissertation. You do a 10,000-word dissertation. I thought I was going to be a neurologist, so that's why I did it in neurosciences. But it's interesting, and you learn a bit about the tedium of working in a lab, and you get to dive into something. You get an opportunity to become passionate about something. Passion is important to drive you forward. And then it's the same course. Or you could do what's called a research MD. In the UK, you do an MBBS, that's a basic degree. What you can do is a 2-year research MD, which is mainly clinical research as a fellow. Or there is something called an academic fellowship, where you could do all of the above, but what happens is rather than having a basic 5-year fellowship program, you have a 8 to 9 year fellowship program, which is long. And actually, it's very competitive. People strive to get into that because those are the ones who are going to get your academic posts in UCL or King's or Oxford or Cambridge. They're going to be the professors. They're going to be running the translational research. So these will be the clinician scientist leaders. So we need some of those. And an important thing for fellows is, ask why. One of the reasons why, the Arab scientists excelled, centuries ago is because knowledge was respected, asking questions was respected. So ask questions. If a patient with 821 is relapsing or is refractory, then ask why. Well, why is that? If a patient with monosomy 7 isn't responding to chemotherapy, ask why. Now, there's a very interesting book called The Big Casino. He's saying I should tell him about a big casino, right? But it's about physicians who like people like Vincent Rajkumar, Bob Kyle, Applebaum, talking about their experiences and patients that they've seen. Something that is salient there is that when they had a problem, a patient comes to them with a problem, like, if you're in Mayo Clinic, who do you go to? Who do you consult if you have a problem, right? So, you have to ask why and try to see with whatever you have to see if you can come up with an answer. So we need inquisitive minds amongst our trainees. So the clinician scientist. So the clinician scientist is an important pillar of medical advancement. So I won't go into that, but essentially somebody, like, we have had Dr. Makadi over here who was chairing earlier. We have some of the other physicians who've undertaken research degrees, and we'd like them to teach us more, or to mentor some of the fellows so they can guide them along that path. So, you try to get a PhD or an MD or even an MSc. And, these will be people that will run labs. So, for example, Mansour Faiz is sitting over there. Maybe he should be doing this talk, I think. But they ask clinically relevant questions, transform clinical observations into testable hypotheses, assure excellence in medical education, and they have specialized perspectives. So they can take a problem that they see in the clinic and be challenged by a patient and then go and test something in a lab. And that's how you get discoveries. And the really important thing is you really need to be IT and AI literate. Mark Cuban, who's one of the entrepreneurs in America, he says, you have two kinds of people in the years to come: people who are AI literate and those who aren't. And physicians are really bad at leveraging the power of IT and computing. So if I were to advise somebody who's going to go into medicine, especially in the US, if you do undergraduate degree and then you go to medicine, I would say, as an undergraduate, do something which has AI or IT or machine learning, and then go into medicine and then leverage your knowledge to use that in medicine. And balance. So we know we work you hard, but it's important to have balance. We want you to have balanced lives. So self-development is important, whether it's in medical self-development or reading, outside of medicine, and setting aside some time for that. I know, we're not very good at it, but we'd like you to be better than us. Don't make some of the mistakes that we've made in sacrificing family time, like on weekends. Make sure you set aside time for family and your kids. Well-being is important. Spiritual well-being, your social well-being, your physical well-being. Again, Nasri's not here. He always tells us where to get shawarma. But once you get a bit older, go light on the shawarma. And, spiritual well-being, you can save money on the yoga classes. Yeah. And, your salah and your azkar, that's really important to just keep your balance. So that's for the fellows. Unmet needs now for the administrators and policymakers. So there's this excellent document about the Hematology Fellowship Program, and these are the aims of it. To produce adult hematologists with adequate knowledge and skills, train fellows to become self-disciplined and self-dependent learners, train fellows to perform research, to produce adult hematologists of internationally acceptable standards. I would say, this is an excellent document, but I would maybe notch it up a bit more to produce a generation of leaders in the field, because you can't lead by following. So for administrators, we all know, so we know we need to increase the workforce, and we know that there is a shortage in the hematology workforce globally. Actually, in BBC, once there was an article that highlighted hematologists as being in shortage. So this is the current. We have F1s and F2s. It's a 2-year fellowship program. So at any given time, so it's like 50-50 males, females, right? We have F1s and F2s. So one of the things that we have discussed is if you have, and is 2 years enough for those foundations? Sometimes you see a fellow, they've done 1 year and they're exceptional. But sometimes a fellow comes and says, I need some more time. We all feel we need some more time sometimes. So is it better to have a 3-year fellowship program? So you increase them by 33%. It increases your average experience. So rather than an average of 18 months of experience, they have 24 months of experience on average. And that's better for patients. But that should, so fellows, I'm going to, on your behalf, I'm going to say, but maybe that should be linked with a financial incentive as well, right? If you're an F3, then there should be some financial incentive
2 minutes.
to that. So this
2 minutes, Dr. Osman.
Thank you. So this is what we thought we would need moving forward. We made this in 2021. We thought we need to double our fellows. We needed more specialist physicians, but we don't have clinician scientists per se. Maybe we have a couple now. But we need to increase those because, especially in hematology with cell and gene therapy, there needs to be a better understanding of, what happens in the lab and understanding of some of the basic science. And so we need to break down the silo between research and the clinical services, which exists. So we need more translation. We need research. We need labs embedded within clinical services, especially the larger academic units. Because there are certain questions and certain research that will only properly be driven by clinicians with their perspective of what they see as the problems that we face with certain diseases. So those questions arise directly from patient care, are driven by a need to solve a specific problem, and more applied and pragmatic. And what happens in the lab, and even when we speak to scientists in the lab, their perspectives of what's important and what's not is quite different. It is important, but in their domain. So we need to bridge that gap with structures within our institutions. So this is a proposal, a suggestion. So at the moment, we have F1 and F2. So what if we were to increase the fellowship, core fellowship to 3 years, increase access to subspecialty training? So there's a lymphoma program in King Khalid University Hospital, hemostasis thrombosis programs as well. We have a lymphoma program, hopefully a leukemia program as well. We have a BMT fellowship. But why not have a third core year? So you increase your end-of-year average experience from 18 to 24 months. And we know that that makes a difference to patient care. Greater experience for the fellow. He's more experienced. He feels more confident. And you don't need to go back and dig your foundations deeper. After that, you have the option of fourth year where they can subspecialize. And maybe that's 30 to 40% of our fellows. They may want to do subspecialization in something. One suggestion is that in the F3, I'm sure many of us would agree that fellows need a bit of training in the lab. How to run a flow, how to run a PCR, how to understand a bit about the genetics. Oh yeah, and one thing is, then the other thing is whether we should incorporate. It doesn't have to be as long as the UK program, but there should be programs, perhaps the societies, whether it's SSBMT or SSBD, or it could be recommended that there should be programs for sponsorship where fellows go abroad, not just to repeat what they've done here, but they gain skills that they wouldn't otherwise get here. So whether it's an MSc program or even a 3-year PhD program. So you develop clinician scientists. And again, that might just be 10 to 20% of your fellows. And again, unmet needs are in benign hematology, like sickle cell. For example, there's an excellent CATCH fellowship for hemoglobinopathies in Canada. I'm not sure if many fellows have gone for that, but surely that's the sort of need we need to fulfill. Cell and gene therapy, fellows who get sort of lab training and GMP training, because that's needed everywhere. Hemophilia and others, which can be discussed. So in summary, fellows, enjoy your training, enjoy the journey, get everything under your belt, because once you finish your training, you can't go back. So make the most of your time. Yeah, it could be a bit inconvenient, but it's a few years and they'll go by really quickly. And we need to develop focused training and develop physician scientists. I think with that, and we can't lead by following, so we need to develop those skills here. Thank you.